while no longer considered a death sentence, is still a major problem.
It certainly is. Data shows when you factor in population, HIV disproportionately impacts minorities. And today, as we celebrate National Minority Health Month, News 8's multicultural reporter Katira Winfrey joins us to tell us more on the so-called invisible Hispanic HIV crisis. Katira.
Well, Phil, Damien Center representatives say in Indiana, 1 in 4 people with HIV are Hispanic. Experts say getting control of these numbers matters now because in a few years, Hispanics will be the majority. Outreach groups and doctors say resources for treatment and testing are there and encourages everyone to use them. There are about 1 million people living with HIV in the U.S. According to the CDC, an estimated 240,000 more don't know they have it.
People of color are facing the brunt of this.
Since the devastating and deadly HIV outbreak of the 1980s, there have been major developments in treatment, and those who get treatment can now live long and healthy lives.
HIV is still a major problem in our community.
And the Hispanic and Latino communities make up part of the so-called invisible HIV crisis. In Marion County, Hispanics make up 10% of the population, but account for 15% of HIV cases. Data suggests poverty, education, language barriers contributes to fewer people getting testing and treatment.
It's very important for us to let everyone know that testing is absolutely free, and you find out right there on the spot.
The CDC says Hispanic men between 25 to 34 years old make up the largest number of new cases, resulting in about 25% of new overall infections.
I see that at the testing center very often. I think people are afraid of reaching out.
Outreach groups and doctors are urging the higher risk groups, like people who are married or dating someone who is HIV positive, or men who sleep with men, to take advantage of PrEP, pre-exposure prophylaxis.
It's taken by people who do not have HIV. They're HIV negative, and it's to prevent HIV infection. And if you take it correctly, it virtually eliminates your risk of acquiring HIV.
And data shows that black gay men still have the highest rates of infection. White heterosexual women have the lowest. You can see a more in-depth breakdown of the CDC's data and find testing and treatment resources on wishtv.com. Reporting in the studio, I'm Wish TV News 8's multicultural reporter Katira Winfrey.